I'm a longevity expert here at Vibrant, and I have the absolute pleasure of introducing you to somebody very special to us. Her name is Dr. Renee Gilmore. So let me just take a quick little intro dive for her. She has exquisite credentials, and I would love to go deep into that, but I want to let her shine, so I'll do a quick intro. So today I have the pleasure of introducing her, Dr. Renee Gilmore, who is an experienced doctor of chiropractic specializing in nutrition and kinesiology for over 2 decades. Driven by the uncovering the root cause of her patient's ailment, Dr. Gilmore takes great pride in providing individual, non-invasive testing to assist and help determine the root cause of her patient's illness. She takes pride in providing the best non-invasive care possible. I'm thrilled to announce Dr. Gilmore. You may take the stage now.
Thank you so much for that introduction. I am so excited to be here. And what I want to tell everybody is what I do is I help people get to the underlying cause of their health problems. And let me just tell you a little bit about my story. Most people who know me, including my patients, know that I am just a health and wellness nut, as you can say. And I have been for many, many years. So I try to eat right. I've always exercised. Get chiropractic care, massage therapy, acupuncture, you name it. I've tried it. I've done it, whatever I can do to maintain proper health. So about a year and a half ago, I tested positive for an autoimmune disease. And that just really blew my mind because I've been doing all of the right things, and yet and still, I tested positive for an autoimmune disease. So after I tested positive, it was just basically wait and see. There was no trying to uncover how this came about, what was the underlying cause, what I could do to to prevent it. It was more like, if you start having problems, you can take XYZ medications. So the autoimmune disease that I had was Sjogren's. And I don't know if a lot of people even heard of that, but I started seeking for answers. And then one day, a young lady walked into my office and told me about a company that provides micronutrient testing, not just average micronutrient testing, but testings that could really get to the root cause. So that's my story. And as I continue to talk, I'm going to go over this tool that I feel like it helped me uncover what was going on with me, how I came about to have this positive test. I don't even want to say disease, this positive test. And now I know what I need to do to get myself healthy. So I don't know, but this is so profound to me. There has been studies done that have shown that the younger generation of today, they're going to live longer. However, they're going to be sicker. And to me, that is just heartbreaking that the millennials, for me, the millennials behind me, the Generation X, Generation Z, they're going to live longer, but they're going to be sicker. And so what we need to think about as a society is that we have become so savvy and so advanced that we have forgotten simple changes or basic things that can make a huge impact. And today I'm going to show you how to determine if your body is truly healthy. Well, a few things that can determine that. So this is a topic of discussion. As you guys can see, I'm not even going to read everything off to you, but if you're on this webinar, I have 4 different things that I'm going to go over. And the first thing is we have an amazing body. It is so complex, so sophisticated. It's the most sophisticated thing that has ever been created. We have these 11 systems and they all have to function together and work together properly. And the one thing that all of these systems need is adequate nutrition. It's an absolutely must. And in order for us to get nutrition, of course, we have to obtain it from our food. So food contains important nutrients. We have our micronutrients and our macronutrients. We're not even going to talk about macronutrients. And that's a big word for saying you need it in large quantities. And micronutrients, that's just a fancy word for saying nutrients that you need in a small amount. And those micronutrients, many people, I'm sure you've heard of vitamins and minerals. We need our antioxidants, our essential fatty acids. Our essential fatty acids is our omega 3s and our omega 6 and amino acids. Today, I'm going to focus on, it's going to be short and sweet. I'm going to focus on micronutrients and food sensitivities. So, vibrant wellness micronutrient tests is so important because it's incredibly unique. In all my years that I've ever had blood work done, the blood work only contained um, information from my blood and not from my white and red blood cells. So what do I mean by that? We're going to talk about what intracellular, all that means is that we're talking about the nutrients that are in the blood, the liquid part of the blood. And that liquid part of the blood, okay, which is the serum, that liquid part of the blood has nutrients in it, but the nutrients that's in the liquid part of the blood, it determines like the micronutrient state short term, so within 24 to 48 hours. So what have you eaten today or yesterday? That's what is basically going to show. So when you have blood work done, a lot of times they tell you to fast just so that, whatever you're eating like a few minutes before is not going to affect your lab work. Now, intracellular, all that means, intra meaning inside of the white blood cells and the red blood cells. This value is more long-term. That tells you the state of the nutrients in the cell, tells the state of 3 to 4 months. And so, for instance, if you had some blood work drawn and in the blood or extracellularly, it's high, but in the white blood cells and in the red blood cells is low, that is an indication to let you know that you are not absorbing the nutrients properly, or either you might have some kind of genetic problem. So it may be high, but that's not a true indication of the true micronutrient stores. So this is incredible because you need both. You need to know what's going on extracellular in the blood portion, the serum portion of the blood, and you need to know what's inside of the cell. When you have the two meshed together, you can get a clearer indication as to what is your actual status. So this, I was surprised with my outcome of how I had normal actually in the extracellular, and then in the cells it was low. So that let me know that I had some kind of absorption problem. Even if I take a lot of supplements, if it's not getting into the cell, then we have to think about another way to get those nutrients into our system. So this is profound. Knowing this information changes the game as to how to look at blood work and how to really truly assess the micronutrients in your body. So ask yourself, do you have a micronutrient deficiency or do you have a food sensitivity? Because if you do, this could be the cause of whatever issue that you are having in your body. So it's profound. So what are some, and I'm just going to go over just a few things. When we talk about minerals, when we talk about vitamins and amino acids, I just threw out a couple of slides just to let you know that having a deficiency, and even having excess, but most people are deficient. But if you have, say, for instance, a deficiency in calcium or copper or zinc, if you have a deficiency in calcium, that could be the reason of your high blood pressure or your muscle cramps or your osteoporosis. If you have low zinc levels, it could be the reason of your hair loss or your thyroid issues or your immune system. So a change actually in your diet and supplementation could be the game changer in your overall health by actually assessing whether you have this micronutrients deficiencies and minerals. And for instance, antioxidants, selenium, you don't hear much about selenium. Selenium is an antioxidant. Antioxidants helps us from rusting, so basically that's what an antioxidant does. You have all of these free radicals in your body, and these antioxidants takes up these free radicals, which helps your body from aging or from rusting, so to speak. So selenium, if you have low selenium, it could cause certain things like thyroid issues or cancer problems or foggy memory. How many people might have a thyroid issue, and your issue may not be, the fact that you need to have your thyroid removed. It may be the fact that you have a low selenium issue. Or how many people have PMS issues, and they've taken all of these different type of medications and done different things, and you've never had your manganese checked. Or a person may have cancer or viral infections or cardiovascular issues, and their glutathione may be low. So this is just to show you that micronutrients are important, and knowing your micronutrient levels intracellular inside the cell and extracellular is key. Uh, um, Essential fatty acids. Here we go. Do you have dry skin or joint pain or difficulty sleeping? Um, or having deficiencies in fatty acids can also have you a risk of blood clots or stroke. So one of the basic fundamental things to your health, I encourage people, if you have anything going on, or even if you don't have a health issue, it's all about prevention. So just make sure that your intracellular and your extracellular micronutrients levels are balanced. So let's talk a little bit about food allergies. Are your food allergies and sensitivities due to food or what has been done to food? We know that there's herbicides, pesticides, toxins, genetically modified foods. It has all changed the state and the quality of the food. So many people have food allergies and food sensitivities, and both allergies and sensitivities can cause inflammation within the body. So food allergies and sensitivities cause inflammation. And there has been a link shown, and even back in 2004, Time magazine did a huge article on how there is a correlation or a link between inflammation and chronic disease and what you can do to fight it. So many of us have these inflammatory processes in our bodies, and we have no clue that is going on. So these are some things that inflammation can cause. We have inflammation in the center. Inflammation can cause cancer, diabetes, cardiovascular disease, neurological disease, Alzheimer's disease, autoimmune diseases, arthritis, pulmonary disease. The list goes on and on. So it's so important to know if you have any kind of inflammatory problems. So what I want to also explain to you, the difference between a food allergy and a food sensitivity. A true food allergy will invoke a response within an hour. So basically, if you eat something that you're allergic to, you're going to have some type of outward symptoms, whether it's itching, or you're going to have some type of hives or difficulty breathing if it's extremely severe. So a food allergy, if you have it, you're going to get some type of response within an hour. It's acute. Whereas a food sensitivity is very hard sometimes to detect because it often has a delayed response. So something that I ate on Monday could be affecting me today on Wednesday. And a lot of times you don't even realize that what you ate on Monday is causing inflammation in your body on Wednesday. So a food sensitivity, a lot of times we're eating things that we have no idea that we are causing inflammation in our body, and it could be a healthy food. When I did my food sensitivity test, I found out a lot of the healthy foods that I've been eating, I'm sensitive to. And there was stuff like spinach, which I put in my smoothies all the time, carrots, which I would eat all the time. I had a sensitivity to it. So every day when I make these smoothies and I put my spinach in it, the other thing was almond. I use almond milk. I had been using things that was causing inflammation in my body every time I ate it. And I can tell you these were things that I ate on a weekly basis. Um, the other thing is that when I also found out one of the things that I was sensitive to, I ended up doing further testing. I also found out that I was highly sensitive to wheat. And I do whole wheat everything, whole wheat pasta, whole wheat bread, and I found out that I had a gluten sensitivity. The other thing about inflammation, it can affect your digestive tract and cause certain things like leaky gut. So the inflammation that I caused due to me eating foods that cause inflammation caused the walls in my small intestine to be penetrated or open up. And so whatever that was in my gut was coming out into my bloodstream, causing a response, an immune response. And as I continue to do research, I found that there's a huge correlation between um, leaky gut and autoimmune disease. So, what I'm doing now is healing my gut, and I'll keep you guys posted. I'm feeling better, but I will keep you guys posted to let you know my negative results next year because I'm staying away from the inflammatory foods. That's first and foremost. Whatever condition that you have, once you find out that you have a food sensitivity, what you want to do is stay away from the thing that causes the inflammation in order to heal your body. But first, you have to find out what it is that you could potentially be sensitive to and stay away from the inflammation. So the question is, who can benefit from micronutrients and food sensitivity testing? Who could benefit? Everyone can benefit from it. I have a list here of anxiety, diabetes, cardiovascular disease, arthritis, but everyone, because you have probably no idea as to how foods, since they've been changed so much, been modified so much with the pesticides and herbicides, we don't know how it's affecting our body. So everyone could benefit from this micronutrient test. So I wanted to make this really nice and brief because I want to get questions from you guys. So today, what did you learn? These are the takeaways that I want you guys to know. Know that intracellular and extracellular micronutrient testing is the best because it gives you the full profile of what your nutrient or micronutrient status is within your body. Um, Micronutrient deficiencies can cause illnesses. So know that having a deficiency either in your essential fatty acids or your minerals or your vitamins could be the cause of, say, your anxiety or your bipolarism or your digestive issues. And it's as simple as changing or changing your diet, giving you more of the micronutrient that you need, and supplementation can make a huge difference in that. And then know the difference between a food allergy versus a food sensitivity. Remember that a food allergy, you will have a response within 1 hour, whereas a food sensitivity will have a delayed response. Also know that food sensitivity can cause inflammation. Why are your joints why are your joints swelling? Why are you having, headaches or different things? Those could be some of the results of inflammation in your body. Also know that inflammation can cause diseases. I encourage you to change your life by ordering a test today to find out what your micronutrient status is, and to find out whether or not you have any food sensitivities. I thank you for your time. The next step is that the next step is that you can click on the link above. You can add the test to your cart, and you can create a new account and verify your email. And I will take any questions that anyone has pertaining to this webinar.
Amazing. Thank you so much, Dr. Gilmore. There is so much to unpack in what you just offered us. And thank you for spelling it out in such a way that we can digest it, no pun intended. But I think what stood out to me the most is the quality of life that we want to live. Yes, we may be able to live longer with traditional medicine, but what quality of life do we want to live, and can we live? And I think these tests are proven to really help with that. So first question, and there are a couple. It says that they have thyroid concerns. Would this be something that would help them?
I would say absolutely, because there are certain micronutrients that are important in order to make thyroid hormones, such as zinc, such as selenium. So by having micronutrient tests taken, you can see where your deficiencies are to see whether or not you need support. And even iodine, it's more common that people think about iodine with a thyroid issue, but a lot of times you don't think about zinc and selenium, and those things are rarely tested. Those antioxidants are rarely tested. So I would say definitely it would be beneficial for you to get a micronutrient test to determine that.
Awesome. Another question that I'm seeing and that we often get is for those that are worried when it comes to food sensitivities. And you mentioned sometimes it's the foods we love and we think and have been told that are extremely healthy for us, but that they may not be serving us right now. So the question is, how long, if we do find out that there's a sensitivity, is this like a forever thing, or what would you suggest? And what is your normal protocol for your patients?
That's a very good question. And I can use myself as an example. I believe that my food sensitivities that I have in terms of spinach and almonds and carrots, the things that I basically eat, weekly, I'm allergic to it, or excuse me, I have a sensitivity to it due to the fact that I have a higher sensitivity from wheat. And I feel like wheat has been the culprit in terms of causing all this inflammatory process. So what I ended up doing once I got my results, I did further testing, and I did another test, which I'll probably do a webinar on that as well. I did a test which is called Wheat Zoomer to help determine how wheat is affecting my body. And what I found is that wheat caused the intestinal or the leaky gut. And so what I have to currently do is I'm going to take at least 6 months to heal my gut with supplementation and staying away from the inflammatory foods.
Mm-hmm.
And then what I'm going to do is I'm going to retest to see what my status is. But I believe that it's going to be a temporary thing once I heal my gut.
Right. And that makes sense, right? Once you heal from inside, you can start to reintroduce slowly. Great. Mm-hmm. Well, I think that's good news for a lot of people.
Yes.
We do have another question in regards to whether or not these tests will showcase if someone's allergic to gluten or not.
And there's a more specific test for gluten, which breaks down not just gluten, but all of the different components of wheat, which I think that needs to be looked at, not just gluten. There's other proteins within that wheat that needs to be tested. So it can tell you if you have a sensitivity, but if you really want to know about gluten, I suggest another test called a wheat zoomer. And it's very thorough, and it can indicate a lot of information, where I know that I'm trying to stay away from wheat, which it's hard, but I want to be healthy. I don't want a manifestation now that I know what the issue is and how my body really is highly sensitive to it. I'm just going to try to stay away from it and just make the modifications, because 30, 40 years from now, I still want to be, live a quality life, not just be here.
Absolutely. And I'm glad you mentioned that. I know Wheat Zoomer is a test that you do offer on your online shop. So I actually put that link in the comments. So if anyone was interested in looking at what else Dr. Gilmore offers, obviously she is being extremely kind in offering the discount that she's offering today. Again, you can get to that by just clicking the top of your screen. And like she said, you just follow a few prompts, add that to your cart. Once you purchase, that test will be shipped directly to you. So from there, it looks like we may have just a couple more questions, Dr. Gilmore. Okay. How quickly will you see the results? How quickly will they get the results from you?
I would say the results, I would say approximately about 2 weeks. Once it's shipped out and, it's tested, I would give it about 2 weeks or so to get your test results back.
Great. Awesome.
And I also see a question here about you be an out-of-state patient. Absolutely, because the test can be sent directly to your home, and then you will take the test kit to a lab, something like either Any Lab Now. That's what we have here in North Carolina. And they will draw the blood and they will ship it to Vibrant America. And then the test results will be sent directly to me. And then the next step, the other most important thing is interpretation of the test. Because a lot of times you get the test, now what? So it has to be a protocol or a treatment plan to help facilitate you and health and well-being, or whatever your illness. There has to be a treatment plan. So that's where I come in with the consultation. We take a look at everything, all of the results, and then once we get the results in, we do a conference call, and I recommend certain foods, certain supplementations, and a game plan to get you to optimum health.
Awesome. Well, that's amazing. I want to thank you again. I think that's all the questions that we have. Thank you so much for your time today, Dr. Gilmore. And yes. This recording will be available to all those who attended and signed up within 24 hours. So if you missed, some pieces of it, just look for that in your inbox. But this special will be available for the next few days. And we just want to thank you again. Thank you so much, Dr. Gilmore.
Thank you.
All right. Bye-bye.
Bye.